Assessing hip internal rotation is very simple. Once again, you just need a bench or a box or a table, like a treatment table like this, that gets your feet off of the ground when you sit on it upright like I am right now. And of course, your camera or phone needs just a stable platform, tripod, whatever, to position it at about the same height as this. If it's a little higher or a little bit lower, that's fine. Okay, so internal rotation, very simple. We'll focus on one leg at a time. In this case, my right leg. You're going to sit tall. Try not to shift your weight. Camera looking directly forward at you, and all you're going to do is kick your foot out to the side. Now, we're looking for 40 degrees of rotation, which I obviously don't have. If you think about 90 degrees being parallel with the floor and 45 being about halfway, we're going just below that. So it's quite a bit, I think, for most people's hips. This is one of the more common ones that I find people failing on. Now, there is some cheats to get a little bit more range of motion, but of course they're cheats, and that would, if you do that, of course, that would not pass the test. The first and most obvious is going to be a hip shift. So notice if I'm tall and I just rotate, my pelvis doesn't move at all, my spine doesn't move, but my leg doesn't move far enough. But if I allow myself to kind of hike this hip up, I can get some more range out of that, and now I might be passing. Okay? So no shifting of the weight, and then of course, 40 degrees of internal rotation. And in the same position, you can check both sides. Okay? Same thing, no weight shifting. If you're not sure if you've passed the test, keep the video and feel free to reach out to us. And then, of course, mark unsure on the assessment form that you are using.